from the American Academy of Pediatrics.
It is back to school season, and parents around the country are working hard to set their kids up for success. And to thrive at school, we need kids to be healthy. And to be healthy, we need, you guessed it, vaccines.
We really want everyone to have the best protection. So that means getting vaccinated. And actually, really, we want people to be vaccinated at least 2 weeks or more before we start to see anything circulating in the community. Because if I vaccinate you today and tomorrow you encounter someone with flu, you aren't actually going to be protected.
Welcome to Healthy Children, the podcast for parents from the American Academy of Pediatrics. I'm Dr. Edith Bracho Sanchez. I am a pediatrician and a mama figuring it out. This is a judgment-free space where all questions are good questions, and the answers will hopefully be even better. Let's get started. Today, we're talking about the latest recommendations when it comes to the vaccines our kids and teens need, the reasons behind those recommendations, and the options you have as a parent. To do it, I have with me one of the smartest people I know, the person I've gone to with all of my vaccine questions since March 2020, Dr. Melissa Stockwell. Dr. Stockwell is a professor of pediatrics and population and family health where I work at Columbia University Irving Medical Center, the chief of the Division of Child and Adolescent Health. She is a national leader in immunization practices, and she's also my boss. Melissa, welcome.
Thank you so much for having me. I'm really excited to be here.
I'm excited to have this conversation with you. It is, as we said, back to school season, which parents at home know means back to germs season. Let's start perhaps with where we are with the germs, or at least the vaccine preventable germs, starting with COVID. It definitely feels, Melissa, like tons of people I know have gotten COVID-19 this summer. How are the numbers looking as we enter the fall?
Yeah, so we are definitely seeing COVID on the rise across the country. So I think what you're feeling and what you're hearing from your friends and family is definitely what we're seeing all around. And it's not surprising. I think we used to say, when you've seen one flu season, you've seen one flu season. I think it's going to be the same for COVID. It's a little bit hard to predict, but at least over the past 2 years, we've definitely seen a kind of a summer peak, and then we see again a winter one. So it was not completely unexpected that we might see a rise. The question was, when we would start to see it. And that is what we're seeing now all across the country.
Yeah, so just because we had a summer peak doesn't mean that we won't have a fall peak or winter peak, correct?
Yeah, I would expect that we will. If it follows like last year, we'll sort of have a peak here. It will kind of continue into the fall. We had a little like to call it a little peaklet early fall. And then into the winter, we saw the kind of bigger peak. Now, last year's winter peak wasn't as big as that huge Omicron spike that we saw, a couple of seasons ago, because that was a big change in the variant. So while we're seeing definitely variant changes, it wasn't a whole kind of big shift. This having one now definitely does not mean that we won't have one later in the winter, and I would actually expect that we will.
And briefly, Melissa, I know we can talk about this for hours, but where are we in our general understanding of how COVID-19 can impact children specifically?
I think that's a great question. So a lot of kids would get COVID, and it's going to be, a mild to moderate respiratory illness, and that's great. But we do know that some kids actually still can get very sick from COVID. And that's why vaccination is really important, which I know is what we're going to be talking about. And also we are learning more and more about long COVID. And that is something that we have not heard a lot about in children, but we definitely know that children can get long COVID and can be quite affected.
Yeah. So tell us more. When you talk about long COVID and other complications, just help us paint a picture of what that looks like.
Long COVID can look different among different kids. So for some children and adolescents, similar to adults, it could be symptoms that continue. So it's not sort of that you have a cough for, 5-7 days and it goes away. It could just keep going and going and going. Or sometimes there are new symptoms that emerge. So one of the hallmarks might be fatigue, or fatigue after exercise. So that might be something that either started during COVID or didn't, and then maybe develop. And sometimes these symptoms actually can develop a month, 2 months, 3 months after the COVID infection. And so it's important for families, if you're seeing that you think your child has a prolonged symptom and they've had a recent COVID infection or a COVID infection in the last few months, really go talk to your pediatrician and ask them if they think that this could be long COVID.
Yeah, and say that specifically, right? I, as a primary care pediatrician, and I'm sure you feel the same way, find it so helpful when families come and say, I'm worried about this specific thing, right? And then we can sort of go from there together.
Yeah. And I think just to add to that is sometimes pediatricians don't know a lot about long COVID. And there are resources on the American Academy of Pediatrics website about long COVID particularly. And so that would be a good place if you think, you go to a pediatrician, it's not something they know a lot about. You can even say, I heard in this podcast that actually the AAP has some important information about long COVID. And we're trying to get the message out there.
Yeah, so important. And to get to the ways that we can help prevent long COVID and other complications from COVID, and the reason we sat down to have this conversation is really to talk about the vaccines. Because the recommendations have changed, families have sometimes been a little bit confused. So when is the updated COVID-19 vaccine expected to come out, and what will the specific recommendations be for kids?
Yeah, so we would expect it to come out, in September. I don't have an exact date on it. They did actually change the variant to be a variant closer to the variants that have been circulating in the spring and summer. But that will not delay the timeline. And the recommendations will be the same right now as the recommendations from previous years. So if you have completed your series, as a child's completed their series, they should get this annual dose because you need a dose, just like flu vaccine, you need a dose every year to protect you. And if your child has not started the series or is incomplete in the series, then your pediatrician can catch them up with the correct number of doses.
Yeah, perfect. And Melissa, just to be super clear, I made this mistake when I was speaking to a family recently. I used the word new. The new vaccine will come out this fall. And they said, what? Another vaccine? So it is not a new vaccine. It's an updated vaccine, correct?
I think that's really important. And I think it's the same. I actually try to talk about it to say it's exactly the same as the flu vaccine, right? So every year for the flu vaccine, we look and we see what are the types of flu that are circulating. We want to make sure we have a vaccine that gives the best protection. And so that is what is put in that flu vaccine. Same thing for COVID. We're seeing what was going around, and we're putting that into the COVID vaccine to offer the best protection for the season. So it's not new. I think one of the messages that sometimes resonates with is to talk about software updates, right? Particularly, everyone has, or almost everybody has a phone, iPhone or Android or some other kind of phone. And we always get that sort of pop-up that says, oh, it's time to update your phone. And if you want to do it, right? If you wait too long, then that's not great for your phone. And so we think about the annual vaccination for COVID and flu is similar to that, right? Think of it as sort of you do the update for your phone, you're doing an update on the protection that you get from vaccination to help your body, your child's body, if they see that year's virus and they're exposed to it, that they have better ability to contain it.
Now, Melissa, how will the updated COVID-19 vaccine work timing-wise with the updated flu vaccine this season?
So you can 100% get them at the same time. There's no problem. And back to school visits are a good time to get the COVID and flu vaccine. And the most important for both of them is to be protected, again, before we start to see it circulating. So for flu vaccine, we usually want people to get the vaccine by the end of October. Most often, flu starts circulating in November or December, sometimes January, but it can be as early as November. So it's important to get vaccinated. And the same for COVID. We really would want to make sure that people are coming in, getting that updated COVID vaccine for the season to protect them for that winter peak, which we would expect to be coming.
Yeah. And I think we're sort of assuming that people are following and understanding this piece. But when it comes to getting these vaccines for school specifically, the idea is that we're catching kids and giving them protection before these things start to circulate. Is that correct, Melissa?
Absolutely. So we really want everyone to have the best protection. So that means getting vaccinated. And actually, really, we want people to be vaccinated at least 2 weeks or more before we start to see anything circulating in the community. Because if I vaccinate you today and tomorrow you encounter someone with flu, you aren't actually going to be protected.
So let's get those shots in.
Yes.
Melissa, let's talk a little bit more about flu, which you brought up. Are we expecting a bad flu season? Do we know?
We don't know yet. Sometimes we sort of see early reports that say, oh, it was a bad flu season in the Southern Hemisphere, and so we're expecting it to be a bad flu season here. I haven't heard that yet, but honestly, I don't recommend people figure out vaccination or not based on if we think it's going to be a bad flu season or not, because really the most important thing is, does your child get flu, right? And that can happen whether it's a bad season or not a bad season.
Melissa, I love that point that you just made. It's really about minimizing that risk for your child. So let's not wait to see how bad the numbers are and then make a decision.
Yeah. And it's interesting because, we see this with COVID too. People say like, I have no idea how I got it, right? You can't guess, right? When you're going to come across someone who has flu or has COVID. So the best protection is to be vaccinated, right? That's the safest thing that we can do.
Yeah. And then hopefully you never come across a person who has flu because everybody has been vaccinated and we stop it. But if you do, you'll have those antibodies ready to go and help you. Melissa, last season, the AAP had said that either the nasal flu vaccine, the one that's a spray that goes into the nose, or the injected flu vaccine were good. Is it going to work the same way this year? Do you know yet?
Yeah, so there'll be both types available. And we actually are already starting to put orders in so that we're going to have it available for parents. And really, it's a preference. So there are some kids who can't get the intranasal. So if you're under the age of 2 and if you have certain medical conditions, but otherwise it really is whether you want to have a spray or you want to have an injection.
Yeah, love it. So you do have that option, but the important thing is to be protected. Now, Melissa, so far we're talking about the two illnesses, right? Flu and COVID that we want our kiddos to be protected against as we enter the fall. They're the ones that come to mind, right? Everyone's thinking flu and COVID. But how do you help families remember the other vaccines on the schedule, aka the ones that they don't necessarily receive every season?
I think there are lots of good ways for people to remember. One actually really good way is I know that the AAP has a printout of like, these are all the vaccines that your child could be due for. And a lot of families like to take that and put it on their fridge with a magnet. And so they can know sort of what's coming. Sometimes a provider will do like text message reminders to say what's coming up. And I actually know the AAP has started a text message service as well about sort of general healthcare for your child. And you can put your child's age in and they'll tell you kind of the things to be expecting for them. So that's another kind of reminder sometimes people like as well. So whatever works for the family is a good idea.
Yeah, I love that. I wonder what you do in your practice. I like to prepare families when they come to see me for the 9-month appointment. I'll say, the 1 year is going to be a little tough. You need several vaccines then. And then, right before when they come to see me for 3 or 3.5, I'll say, the 4-year-old visit is going to be a tough one. You're going to need some vaccines. And I try to do the same thing at around 11, right? Like the 11-year-old. What do you do, Melissa, in your own practice to help families sort of be ready for the visits that do involve more vaccines than usual?
Yeah, I think I do a similar thing in telling them what's coming up, but I actually try and put a positive spin on it, particularly for the young ones. If you see them as a newborn and the 2-month visit, and I'll make it very positive. This is really great. We are going to come in the 2 months and we're going to start to get the baby protected against all of these things, right? Or similarly for teenagers, in the next visit, we're going to do this and this and try and talk about why we're doing it, right? We're really doing it for the protection of the child and then the family. And so I really try to explain even ahead of time and not wait for the visit where we're vaccinating.
I love that. I'm going to take that positive spin, Melissa, into my practice. And it's genuine because, really, when you're a new mom and you have a little newborn, right, you're sort of like, nobody cough on my baby. Everyone wear a mask, clean your hands, right? And as we get more protection in, we're able to loosen up a little bit and let kids be kids. So the positive spin is genuine, and I'm going to take it into my practice. Now, Melissa, what do you say to families who say, well, last year you told me to get the flu vaccine and we all got the flu vaccine and then we got the flu anyway. And the same thing can be true for COVID-19. What do you say to those families?
I think this is a really, really important point. So we are vaccinating to help protect against infection somewhat, right? That, yes. But in reality, a child could still get flu or COVID. But what we were really protecting against is significant disease. So the big bad things, right? We don't want kids to end up in the emergency room. We don't want kids end up hospitalized. And so that for both flu and COVID, really the best protection is against those things.
Yeah. Melissa, I will never forget. I don't know if I've told you this story, and we talk a lot, but I don't think I've told you this story. I had a family once. They came in, a mom and a son, school-age little guy, and he had minor cold symptoms. And I can't remember why. I tested him for flu. I think he also hadn't had a fever for several days. He tested positive for flu in the office. I hadn't given him the flu vaccine. And the mom turns to him and says, when I told her that they had the flu, the mom turns to him and says, see, good thing we had that shot. We ended up here and not in the emergency room. And I was just like, such a win for actually preparing families, right? Like, we sort of did talk about that. If you get the flu, I want you to end up here with me, not in the emergency room. And it worked. And I will never forget that.
Absolutely. And I think that's a great, great story. I think if we tell parents up front, right, what is the reason we're vaccinating, then it's not a surprise to them, right? If they ended up, most kids won't get the flu. If your child did get the flu, then really it's going to be much more likely to be a very mild case.
And lastly, Melissa, we like to close out our episodes with what we call a parenting prescription. When it comes to vaccines in this back to school season, what is one thing you want all our listeners to know?
So it's really interesting. They've done a couple of surveys of sort of public health practitioners that what is the most important public health advancements of all times? And vaccination is always in the top 10. And that's because we have come so far, really, if you think about it, right, in having all of these different tools that we can use to keep our children healthy. And so I would say to families, really take advantage of those. If you have questions, talk to your pediatrician. They would be really happy to answer any questions that you have.
We are here to help and help you keep your kids healthy and thriving. Thank you so much, Dr. Melissa Stockwell, for joining us today. This was fun.
It was really great. Thank you so much for having me.
And thank you at home for joining us. If you like the Healthy Children podcast, please subscribe on your favorite podcast app and help us spread the word. Follow Healthy Children on Instagram, Facebook, and Threads at Healthy Children AAP, and be sure to visit healthychildren.org, the parenting website of the American Academy of Pediatrics. Healthy Children is a production of the American Academy of Pediatrics. Our creative team includes
Ann Johnsos,
Doug Nagel,
Susan Stevens-Martin,
Laura Alessio,
Jackie Ortega,
Mary Claire Walsh,
Hannah Weston,
Kathy Jewell,
Catherine Beard,
and Garrett Brown.
And our theme music was composed by Doug Nagel. We'll be back next week. I'm Dr. Edith Bracho Sanchez. Thanks for listening.